Dr. Mac, how are you?
I'm all right. How about you?
All right, we made it to Friday.
Oh yeah. Oh yeah. Oh yeah.
Man, I tell you, I could not wait. This has been the longest week ever, and but I think we say that every week though. It just seems like it just
Yeah.
we get hit with it
Yeah.
every week, and we just have to keep pressing through, and with that hope for the weekend to get a little reprieve, right?
Yes. Got to keep rolling.
Got to keep on rolling. Exactly. So I just want to thank everyone for joining us here on the Network Live. I'm April Garner, the network founder. And of course, every week I am coming at you with Dr. Winston McIver Jr., who is the owner and primary practitioner at Waccamaw Primary Care. And it is so good to see you once again this week, my friend.
Yes, ma'am. Good to see you as well.
Absolutely. So we are bringing to you, of course, week 28 COVID-19 updates. And as you all know, you've been keeping up with the news. A lot is happening with COVID-19, a lot circulating in national and local news regarding COVID-19. Of course, we've all been keeping a close eye on the developments in Washington, D.C. With the president, who obviously came down with COVID and is now returned to 1600 Pennsylvania Avenue. And, you know, we're still trying to figure out exactly what's going on there. But, you know, from the national perspective on down to the local perspective, the latest news with the possibility that Horry County schools will return or will actually go to full virtual instruction starting October the 19th, because there's a increase in cases in Horry County. And so, yeah, a lot is going on, and all of it is pretty much reminding us that COVID is still alive and well. And so, yep. So Dr. Mac is here today. And as always, he's going to give us some statistics before we go into our COVID slides. And so, Dr. Mac, with that being said, do what you do best.
All right. Thank you. Appreciate it, April. Appreciate it. Appreciate you all joining us today. You know, pretty much for those that are new to the show, what we do is we give week to week stats, you know, what's going on in the world of COVID in the last week. Worldwide, the number of cases have gone up about 2 million, from around 34.5 million up to over 36.9 million cases. The number of deaths worldwide have gone from 1.03 million to 1.07 million worldwide. In the United States, the number of cases have gone from 7.5 million to around 7.8 million. And the number of deaths in the last week have gone from around 213,000 to 218,000 deaths in the United States. Now, specifically in South Carolina, in the last week, the number of cases have gone from right under 150,000 to right now over 155,000. That's in the United States. Probable. The number of deaths in South Carolina have gone from right at 3,400 to over 3,500. That's confirmed and probable cases in South Carolina. Horry County, the number of cases in the last week have gone from right at 10,000 to right around 10,300 cases. And the number of deaths have gone from 86 to 88 confirmed deaths in Horry County, with 16 probable deaths related to COVID. Georgetown County, the number of cases are 1,776 confirmed and 230 probable cases. And for the deaths, it was 34 confirmed and 10 probable deaths. Marion County, the number of cases have gone from 887 cases to 933 cases, with another 42 probable. And the deaths in the last week in Marion County have gone from 27 to 31 deaths. So what we're seeing here, we'll go to the graphs now, actually, go to the charts. Okay. So I'm a visual person, and I, like to do things visually so everybody can see. This is the graph of what the cases look like in the United States. So what's happened is in the last 14 days, the number of cases have gone up 12%. The number of deaths have gone down 4%, but that number of deaths even has kind of, gotten into a negative kind of way where we're seeing a little bit more deaths here because that was less than that before. So the big thing is though right now is looking at these number of cases going up 12% in the last 14 days. And if you see it, you can kind of see the graph on the far right is actually starting to slope up. There was a dip down around mid-September. Yeah, but right there, the graph is actually starting to go up. So we are starting to see more cases in the United States. And that's certainly as a result of cold and flu season approaching. And so again, that's something to watch out for to see what happens to the tail of that graph as it's actually going up. Next slide. Next slide, where the cases are rising fastest. Of course, the darker the color, the more it's rising faster. You see it tends to be more centralized in a lot of the Midwestern type states. Southeastern and Midwestern have a little darker color to them. So this to be on the, knowledgeable about where in the United States these cases are rising for people who are planning on traveling, just so you have an idea too of where these cases are going up. Next slide. Now, as we've said over the past 3 or 4 weeks, the number of deaths do appear to be going down, but that's not a huge decrease on that graph. If you look into the far right, it does look like it's going down some, but again, you'd like to see a sharper decline there at this point in time in the game, especially with it approaching cold and flu season. Okay, certainly not where we were in April, May, and June, but certainly the numbers aren't dropping off as much as we would like for them to have dropped off headed into cold and flu season. Okay. The next slide, I wanted to put this in. It's a new piece of data that I've been watching as well, and this has to do with college campuses across the country, and it's organized by state. And if you see, in Texas is certainly the highest there. 82 schools, they've had over 14,000 cases. Georgia, 36 schools reported 9,800 cases. But if you see South Carolina, 5th, 8,100 cases at 26 schools. So those are numbers to kind of watch out for on college campuses. A lot of the colleges have been made aware of this fact, and I know a number of them are doing everything they can do to try to reduce this. But again, a lot of it has to do with the activity of the college students and responsibility that they're having to make sure that they, protect themselves with social and physical distancing as much as they can. Next slide. Okay, so looking at South Carolina specifically, and this information was just released today, the DHEC has announced 874 new confirmed cases and 74 probable cases. Additionally, 14 deaths in South Carolina and 2 probable deaths. So what happens is, those are the same numbers that I gave earlier, but I just want to make you aware that these numbers are going up. They appear to be going up. And so again, that's one of the reasons why the schools are revisiting their plans about maybe going all virtual, where some of them were hybrid in the past. And this is something that definitely I'll keep everybody abreast on as we do these Friday shows. But the numbers are showing some changes that are worrisome and concerning. Next slide. So what these slides are, and I just want to kind of compare South Carolina to North Carolina because, the proximity of the two states and a lot in common. So in the Carolinas, when you're looking, the graph on the right, on the left is South Carolina. And as you see, that curve appears to be going up on the far right end. And in the last 14 days, there's been a 20% increase in the number of cases in South Carolina. Now the deaths have gone down 6%, But still, that 20% is significant. And it's really significant too, because there just has not been the robust testing in South Carolina like it was during June, July, and August. So I always got to keep that in mind, that there's not as many tests that are being done compared to those summer months, when especially around here, you're going to have 2 or 3 community tests in a week. So we're not seeing that as often, and that's across the state. But again, the number of cases haven't gone up 20%. But let's look at our neighbors to the north of us in North Carolina. Their 14-day average has gone up 40%. So I want to bring that to the attention, because there are a lot of people that live in South Carolina that work in North Carolina. And so again, I just wanted to bring that as a comparator. Their number of deaths have gone down, but their death rate was higher than South Carolina. So coming down 17% is great, but still the numbers are still much higher than we want them to be. But between those two states, we're talking about 20 and 40% increase in the number in the last 2 weeks. Okay. Next slide looks at the deaths. Thank goodness the number of deaths do appear to be continuing to decline, which is great. That's what we want to see. That's what we want to hear. But again, as the number of cases go up, you would expect that there will be somewhat of a bump in the number of deaths. And as you see, kind of the last very part of that graph is not really continuing to slide down like it was in August and September. It seems like it's kind of flattening off. So that's a concern, that the number of these deaths may be starting to flatten off. And unfortunately, sometimes that will come before the numbers start going back up. As you see back on the graph in May and June, where it kind of flattened off there and then it took off. What we don't want to see is a flattening. We want to see a continuing decline to let us know that the numbers are continuing to go down. But that curve, that graph is flattening, okay? From the end of September through right now, it has more of a flat appearance to it. So that needs to be continued to be watched as well. Okay. Okay, so this is in South Carolina, and it's looking at the number of tests, 1.5 million by the cases, 555,000 hospitalizations, a little over 9,000, and deaths 3,500. Now, right now, South Carolina has a positivity rate of between 10 and 11%. Okay, now I know about 6-8 weeks ago, we talked about positivity rate, what it means, and what's acceptable. An acceptable positivity rate is less than 5%. As a matter of fact, when the CDC first came out with their guidelines to look at when do we start easing restrictions, it was 2 consecutive weeks of a positivity rate less than 5%. Okay, for those of you that have been watching us, for a while, and those who are just hearing this for the first time, the guidelines to determine whether or not an area, community, state, region were dropping down and were getting better was a positivity rate of less than 5%. And right now we're between 10 and 11%. Okay. The reason why positivity rate is so high, it's so important, is because when you have a positivity rate that high, higher than 5%, it usually indicates that there's a problem in that community, and that community probably needs to do more testing to kind of see exactly what all is going on. But that's one of the very important things about a positivity rate. I will be a part of a testing, of mass testing that will be done here in the area. The dates hadn't been solidified yet, but I was contacted by a person from DHEC who's interested in coming to the area and doing more testing, primarily because the numbers are going up, and that information will be released as the when the date becomes more solid. Okay. Next slide. This is specifically with South Carolina. Colleges and universities, like I showed you, like we showed you in the earlier slide, that was 26 schools. There were a little over 8,000 cases at 26 schools. In the prisons, out of 15 prisons that are reported, almost 3,000 cases were there. And in the nursing home, out of the 21 facilities that reported, a little under 2,000 cases were there. So I'm not quite sure what to make of this 54 cases at one cluster. That information wasn't really explained when I read it. So I put it on the slide. But again, the first three are really what are very important, particularly the colleges and universities, and particularly in these prisons. So again, just to make folks aware of what is actually going on there, to take a look at it. Okay. Next slide. Okay, so this slide is kind of a busy slide, and I'm not quite sure how much you're able to see on that, but basically this is talking about hospital bed occupancy, and 84 hospitals did give the information that was needed here. So out of those 84 hospitals, there were a total of 12,353 beds. 10,000 were inpatient beds. A little over 8,300 beds were occupied, which is a utilization rate of about 84%. Now that's high. That means 84% of the beds are utilized to some degree. Out of those utilized inpatient beds, right at 10% of them are related to COVID-19. So that's what that 748, right under 10% are hospital beds right now are COVID related admissions. Out of the ICU, which is the middle column, the 1,461 ICU beds in these hospitals, 1,100 are occupied, or 73%, 78% are occupied. And out of the ICU beds, 26% are COVID. So that's, basically what 1 in 4, a little more than 1 in 4 ICU beds are related to COVID patients. So again, that's a high number. And the far right column is the number of ventilators. So there's over 1,600 ventilators in these beds. 30% of them are in use. 13% of them, ventilators, are used by COVID-19 patients. Just to give you an idea of what the hospitals are dealing with as far as occupancy, ICU admissions, and ventilator usage, just to give you an idea and this is in South Carolina. Okay, good. All right. Okay, good. So, so there's been a lot of talk about, President Trump, what was going on. Did he really have COVID? What was going on? My impression as a physician is that he had COVID. Okay. I couldn't see ethically physicians giving a patient those kind of medicines if they didn't have it. Okay. Whether they signed a non-disclosure or not, you're giving medicines, some of which have that cocktail that he had together was not an approved cocktail. It was not a regimented cocktail. And, he just looked sick to me. He sounded a lot. I mean, he just looked and sounded sick. And the truth be told is that if he's positive, he's supposed to be in isolation for at least 10 days. And so anything sooner than that is against the guidelines. But again, there hadn't been a whole lot of following of the guidelines in the first place. And it's been really, do as I say, not as I do. Not as I'm told by the people that do this for a living. So that's the thing. The other thing too that's really interesting is probably the most quoted journal in medicine is the New England Journal of Medicine. New England Journal of Medicine is known for their scholarly research, their scholarly publishing of research and data. And at no time in the 208 years of the New England Journal of Medicine have they basically taken a political stance. But they came out and said that he's made this tragedy a crisis. They came out and said that he's acting irresponsibly with what's going on in the United States. That the rhetoric, the talk, the lack of following, guidelines from, people that do this for a living is reprehensible. And, it's leading to more people. I mean, they have an outbreak in the White House. Okay. It is a hot spot. spot. It is a hot
Yes,
spot.
it's a hot
When you
spot
look
now,
at
right?
how many people are in the White House or have access to the White House, coupled with the percentage of people that tested positive, it would be considered a hot spot. Plain and simple. So, again, as the rhetoric goes, a lot of people who are making this political will follow that rhetoric. So again, COVID is here. It's like I said 28 weeks ago. We're the variable. The virus is the constant. As long as we don't do what we're supposed to do, the virus will be here. Period. Point blank. Period. And so I'm concerned. I'm glad that the school district is starting to take a second look at this, because again, this can be a wildfire that can burn real fast.
Mm-hmm, mm-hmm.
And it's I mean, as we get further into the fall and winter, more people are doing more indoor things. Some of these places don't have the best ventilation.
Mm-hmm.
And this can be a recipe for disaster. The latest studies that I've seen from the University of Washington biometrics is we're talking about potentially, close to 300,000 deaths before January 1st.
Oh my goodness.
And at first, they have a history of being good at what they do, but certainly when they started publishing this stuff early on, I was like, I can't see that happening.
Mm-hmm.
But every benchmark that they put up is come to pass. Every data point that they put on where we will be at a certain point in time has come to pass. And so again, it is very likely that can happen. Right.
Well, it's certainly a lot to take in and unpack when you take a look at the handling of everything, and the fact that now that the president has returned to the White House, which was already infiltrated with cases of COVID anyway, and it's now considered a hot spot in the nation. I think that it's kind of falling in line with what you said would happen if we weren't fully cognizant and aware of what could happen like the latter part of this year. It was bound to happen to him eventually, if it hadn't already happened and he hadn't already been walking around with it for as far as I'm concerned. And there are other controversial issues that have kind of surfaced within even that whole situation as far as how he was treated. There's some reports that he was possibly treated with stem cells, which goes against what his political stance is. So, there's so much that's wrapped around that. And it's kind of hard for people to, to take in all the information and separate from it what they really need to understand as far as, what's to come, but also how they should, I guess, view or develop a perspective of the deadliness of COVID-19. You're right. What we've seen as far as how the president looks, if you had to go back and look at videos over the past couple of days, he looks like he's struggling, like he's, trying to hold on for whatever reason. And I think there's going to be a lot more fallout. And unfortunately, whoever's in the White House is going to have to deal with that. But even from a local standpoint, now that we've seen that these cases are going up, we would hope that our local officials and agencies will make the right decisions as it impacts our children, our teachers, our parents, staff members, everyone who's involved in the school district. And I know that there's some concern about, with these cases going up, does that indicate that we're going to see more cases in young people? Where are these cases happening? Like I just pulled some information up from, the WBTW website, and it says the dashboard below shows cases by school in the Horry County School District. And so as you look at, they're starting to report that kind of information. I don't even know if we've had that information before, Dr. McIver, but, that is something that's very interesting to just kind of take a look at as well, because we may be able to, if we're studying it and keeping up with it, see, where the trends are happening. And,
Right.
It's a little bit too much information to go through right now. But from what I'm seeing, it's happening at the middle school level. It's happening at the elementary school level. Definitely at there's one elementary school that historically has 7 cases at an elementary school here in Horry County. So, you may want to go to WBTW's website and pull up this information. But, it kind of goes back to...
It has been out there. The only problem that I have with it, and I've seen it, the only problem with it is that I believe it's a far, far underestimation of what it is.
I agree.
So I never really talked about it on the show because I knew that it was going to be an extrapolation of what it really was. Those numbers are not accurate for various reasons. They're not accurate. But I will say this, just like I've said before, and I've been studying this stuff really regularly. If people don't do what they're supposed to do, people will start dying around here again. I'm saying this and I mean it. I'm not trying to be dramatic because that's not really my nature. But if people don't do what they're supposed to do, people will start dying, okay, around here again. Okay. And, regardless of what the school board chairman is saying and all this kind of stuff, I'm a physician. And every physician I know is saying the same thing. Okay. I didn't wake up one day and become a physician. I don't play one on TV. This is what I do. Okay. So whenever politicians start talking about these numbers and talking about this, I hope they're talking to physicians. Let me say this again. I hope they're talking to physicians who've been studying this stuff. Because anybody can go to the computer and pull up numbers. Anybody can go to the computer and pull up this and that. Okay. I've had now over 200 patients with COVID. Okay. I'm not telling you what I think. I'm telling you what I know. And I'm telling you what's happening. And all this stuff about the numbers don't add up. What's adding up is over 200,000 people dead. That's what's adding up. So if you're looking for 1 and 1 to equal 2, it's not going to happen.
It's not going to happen.
This is science. 1 and 1 doesn't equal 2 all the time. This is science. So all this rhetoric about this and that, I hope people are doing the right thing. I hope they're making decisions based off of the right information and that they're doing the right thing and they're not playing political games with this, because people are dying. And I'm telling you, this will be a rough cold season, flu season, pneumonia season, strep season, hence COVID season. And you can get COVID with any of those other things that I named. As a matter of fact, the majority of people that are dying from COVID are dying from pneumonia. So all this other stuff that we're talking, all this other, rhetoric about the numbers aren't adding up and this and that, I hope these people are doing the right thing, and I hope that they're making decisions based off of the right reasons. Okay? You can't put a price tag on a person's life. You can't put a price tag on it, because not only is it affecting the school, but you got these kids that live, some of these kids live in multi-generational homes. In other words, there's the child, there's the parent, and there's the grandparent. So when you do that, you're putting all those people at risk. Okay. And let me say another thing to these churches. Okay. I love churches. I'm a deacon in my church. I love God just as much as the next person. God got me where I am. But let me say this. You ministers, you better think twice about reopening your churches right now, especially with these numbers going up. Because if you go ahead and you reopen these churches too soon, you're going to have some deaths on your hand. And it's not going to be hard to contact trace where they got it from. That's my word to the wise. I'm not talking about any church. I'm not talking about any minister, but I'm talking what I know. Okay. And opening these churches too soon, you're opening your parishioners up to disease and death. And let me say one other thing too. Okay, why are we talking about this? A lot of times people are saying, well, there's a 98% recovery. 98% recovery. And yeah, that's true. That's true. As far as when you're talking about the difference between life and death. Okay. But if a person goes into the hospital who has asthma or COPD or any kind of lung condition, and they weren't on oxygen before they got COVID, and they left the hospital with oxygen, I contend to you that that's not recovery. They lived, but did they really recover? So whenever we're talking about recovery, we need to make sure we know what we're talking about. We need to understand what recovery really means. Recovery is not just life and death. Recovery is extension of a chronic condition. Okay? And I've got at least 30 people that had some lung condition that was not on oxygen before they went in the hospital. And guess what? They came out of the hospital on oxygen, and they will probably be on oxygen for the rest of their lives. So we need to make sure we understand what recovery really, really means. Okay.
So, Dr. Mack, we also are here to give our viewers a quick medical minute on another, I guess, medical issue that actually affects communities, men, women, and everywhere. And so we've decided to do that as well for those of you who are just tuning in for the first time, the COVID-19 updates, and then also our medical minutes. And of course, this month we have a focus as well on breast cancer awareness. So, but today we're actually going to just talk a little bit about lung cancer. And believe it or not, October is Healthy Lung Month. It is also Breast Cancer Awareness Month. And so, you know, we can definitely bring to you some information about some of these conditions and illnesses that affect us, especially when it affects the Black community in disproportionate ways. So, Dr. Mack, what can you, I guess, teach us today about lung cancer?
Okay, so like April said, we decided not to just have this segment just about COVID. We want to also add some more information in, and kind of decided to kind of focus on cancers, and we're talking about different cancers. And so today we'll talk a little bit about just a little bit about lung cancer, because it's certainly more in depth and certainly more information than what I'll give you, but I will hit some high points. In 2020, it's estimated there'll be over 228,000 new diagnosed cases of lung cancer. Okay, over 112,000 in women and over 116,000 in men. In 2020, it's estimated that there'll be over 135,000 deaths related to lung cancer. In women, about 72,000, and in men, about 63,000 deaths. Most diagnosed cases of lung cancer happen after the age of 65, with the average age being around 70. Now, a lot of people may not realize this, but lung cancer is by far the leading cause of death in men and women. 1 out of 4 deaths of cancer are related to lung cancer. 1 out of 4 deaths with cancer is related to lung cancer. More people die from lung cancer than colon cancer, breast cancer, or prostate cancer combined. Let me say that one more time. Lung cancer is by far the leading cause of death in men and women. 1 in 4 deaths related to cancer are related to lung cancer. More people die from lung cancer than colon, breast, and prostate combined. That's how big of a problem it is. Now, certainly in, you know, the region we live in, the Southeast, which is called the stroke belt, the Bible belt, the tobacco belt, you see a lot of these things more commonly because there are more people that are actually smoking. And we'll get to that in just a little bit. However, on a positive note about lung cancer, the numbers appear to be decreasing, primarily because people appear to be smoking a little bit less, and because of early detection and better treatments with lung cancer. Okay, The lifetime chance of getting lung cancer is about 1 in 15 in in men, and about 1 in 17 in women. Okay. African American males are 15% more likely to get lung cancer compared to white males. But African American females are 14% less likely to get lung cancer than white females. And a lot of that has to do with the trends in smoking. Okay. So again, that's just a statistical fact. Women have lower rates than men overall. The lung cancer rate is decreasing in men over the past several decades, but in women, it's been decreasing only within the last decade. Okay. So the one thing that you talk about is prevention and early detection of lung cancer. By far, the number one risk factor for lung cancer is cigarette smoke. Okay. About 80% of all lung cancers are associated with cigarette smoke. That includes cigar and pipe smoking. Okay. The longer you smoke, the more you smoke, proportionally, the more likely you are to get lung cancer.
Dr. Mack, does that include secondhand smoke?
Yes. Yes.
Okay.
Yes. And there's still a lot of information to be obtained on secondhand smoke, but we do know that is a risk factor as well.
Okay.
Okay. So with that being said, some of the newer and earlier detection that's being done is what we call these low dose CT scans. So it's a little bit better picture than an X-ray, but not quite the radiation from a regular CAT scan. And a number of the insurances are covering it. So if you are a smoker, I would encourage you to check with your insurance company and see if they cover the low dose CT scans. That's shown a significant improvement in catching these early cancers. It's very important because sometimes a chest x-ray will not pick it up, and there's different kinds of lung cancer. And I didn't prepare that for this talk because there's a lot of in-depth related to the different types of lung cancers and the survivability and those kind of things. But just understand that there's more than one type of lung cancer. Okay. Small cell, non-small cell, and there are different variations within that. So for this talk, it's not quite appropriate. But again, for general purposes of the talk, to understand that cigarette smoke is the number one risk factor. Secondhand smoke is a significant risk factor. Early detection is what's indicated to try to help, because the gold standard treatment, the best treatment there is surgery. That's the best chance for a cure. The problem is that most people don't know they have lung cancer until they're advanced. In other words, the overall 5-year survival rate for lung cancer in African Americans is 16% and 19% in whites. The overall 5-year survival rate. Okay. Now, again, the more localized, or the more that cancer is localized to one area in the lungs, you have the best survivability rate, which is about 52%. However, only 16% of cancers are caught at an early localized stage. Let me say that again. When lung cancer is found in one area in the lung and it hasn't moved anywhere, we call that a localized lung cancer. Okay, it's localized. The 5-year survival rate is 52%. However, only 16% of cancers are found when it's in a localized state. In other words, what am I saying? Most of these cancers have spread beyond the lung by the time you find it. Liver or other organs, most likely. Okay. Again, surgery is the best chance of cure. The best chance of cure. Again, the individual 5-year rates depend on the grade, meaning how aggressive the cancer is, and the stage, how far it spread from the initial site. Okay.
We have a couple of questions, Dr. Mack, and I have one of my own. Okay. Let's start with the environmental issues. What are some environmental conditions that could contribute to
Right.
lung cancer aside from just the smoking,
One of it is asbestos. So a lot of times, a lot of these buildings had asbestos in it, and so that can contribute to lung cancer. Living close to a factory or a plant, that didn't, because years ago, emissions data, our emission standards weren't as strict as they are today. And you'll find some of these plants, factories have closed, have been demolished around here even.
Yes.
Concerned that they didn't meet the EPA standards for reduction in emissions, which could potentially lead to cancers, whether it be in the water with arsenic and other chemicals, or whether it be airborne and causing other issues like that.
Can there be some more domestic factors? And when I say domestic, I mean like in your homes, mold, mildew, things like that. Could they contribute to any kind of lung cancers, or is that just mainly respiratory type issues that could result?
More respiratory type conditions, but if you smoke and you're already making your lungs weaker, this can certainly lead to other things. That would be more along the lines of things like funguses in the lungs and other things like that could be related to weakening the lungs even more.
Okay. All right. So Dormaine Nixon is watching today. Thank you so much, Dormaine. He asked, what age should you get checked?
Well, that's a good question. And when we talked about check, if we're talking about a low dose CT scan, you'd want to check with your insurance companies to see at what age they will cover it. I don't know quite the price for it, but I would say if you've been smoking more than 10 years, you definitely should have some type of imaging study done, even if it's just a regular plain film x-ray.
Okay.
Because again, the duration and the amount that you smoke will increase your chances.
Awesome. So Dorothy Reeves, there's some feedback for some reason. Dorothy Reeves asked, what are some of the symptoms? Would someone have pronounced symptoms in order to determine that? Okay.
Some of the symptoms that you see, one of the main ones is shortness of breath, of course. Exercise tolerability is not the same way. So the person's not able to, exercise, or their endurance is not as good, and they have a smoking history. A real ominous sign or a real bad sign is a person coming in and saying, I'm coughing up blood. Because what that means, if it is lung cancer, it means that the cancer has started to erode the lung and erode the blood vessels, and that's why the person's coughing up. Unexplained weight loss, recurrent bronchitises or pneumonias that keep happening. Those are things that you get concerned about, just to name a few.
Okay. All right. So if you have any other questions or concerns and you like for Dr. Mack to address it as best he can today on the live, please post it below. And we would certainly get to your questions or even your comments. I know Dr. Mack and I usually kind of toggle in between the thread that's shown to us and then other social media pages and groups that we're connected to. So we will get your question if at all possible. But I definitely wanted to just kind of bring your attention to a few other things that, we'd like to make sure you are aware of when it comes down to, Awareness Month activities. And so and Dr. Mack, thank you so much for all of that great information about lung cancer. And again, this is Healthy Lung Month, as I've recently learned. And there is like a lung day and all this other good stuff. It's quite a bit of information out there. But this is also National Domestic Violence Awareness Month. And so, according to the National Domestic Violence Awareness reports, October was first declared as National Domestic Violence Awareness Month in 1989. And since then, it has been a time to acknowledge domestic violence survivors and to be a voice of its victims. And so we want to make sure that, we are paying attention to this national crisis as well. As you all know, just recently, Myrtle Beach Police Department lost a police officer, and the nature of that particular incident was rooted in a domestic violence situation. And so you just never know who it's going to impact and how, but to the millions of men and women who are actually living in domestic violence situations every single day, it's important for us to acknowledge that this is definitely something that plagues our society And as much as possible, we want to make sure that we're aware of any signs or any issues that we may be able to recognize, so that if you believe that someone is in a domestic violence situation, you can get them some help or direct them to some resources. So I think what I'm going to do, Dr. Mack, is try to find us a guest who can come on and talk a little bit about that. And, because I think it is very important that we lend some time to the acknowledgement of that particular this particular cause as well. But I do want to share this statistic with you. The U.S. Department of Justice estimates that 1.3 million women and 835,000 men are victims of physical violence by a partner every year. So it isn't just a female thing. It is, obviously men and women can be victims of domestic violence. So definitely want to make you aware of that. And if you will, just make sure that if you even need some information or whatever, reach out to me and I'll get that. But I'm gonna work on trying to find someone who can come on and just share a few minutes about this particular cause as well. The other thing that's real important for us to understand is what's happening now in our nation. It's election time, and absentee in-person voting has started, as some people call it, early voting. It started on Monday, and people are showing up at voter registration offices to cast their votes early. Typically, you can cast your vote early if you're unable to make it physically on November 3rd to cast your vote in the elections. But we want you to understand that it's so highly important, especially in this 2020 election, that you cast your vote, that you make sure that you show up at a voter registration office if you know that you cannot be at present on November the 3rd at your regular poll, and that you cast your vote. Okay. So I'm going to give you some information now about who's on the ballot in South Carolina for the November 3rd elections. And then I'm also going to tell you what the absentee voting locations are. And so on our ballot, and I'm giving you this information mainly because, and we just did a show about this on the Whittemore Community Magazine Live this on Monday, this Monday past, and we had the Horry County Democratic Party on the air. Thank you so much. We had the Horry County Democratic Party on air. And there are members of that party that actually talked about, what's at stake, what we need to know as far as the South Carolina elections are concerned, of course, our general election, and then also the importance of understanding where these polling locations are, especially for the absentee voting. So our Democratic candidates, and I'll say this because the Whittemore Community Magazine Live is a nonpartisan platform, meaning if you're Democrat, Republican, Libertarian, Independent, we don't care who you are. If you want to, spend some time educating the community on what your platforms are, sharing your viewpoints, and actually getting into a discussion about your agendas, then that's definitely what we invite you to do. And we have always invited members of all parties to come and be a part of our discussions, but we've really only had discussions with the Horry County Democratic Party, which they've, actively sought us for to disseminate information. And the same thing goes for the Network Live. We're nonpartisan, and we need to have conversations with all parties involved so that we can develop an understanding across our communities as to why we, are following a particular platform or not. And so it's just healthy conversation for us, and it also makes us more aware of the standpoints that people have and perspectives they have when it comes down to politics and government and everything that affects all of our communities locally and nationally. So I'm going to share the Democratic Party ticket, of course, for president and vice president. You all know Joe Biden and Kamala Harris are who we will be voting for, or I should say who you can cast your vote for if you so choose. And we have seen both the presidential and vice presidential debates, at least the two that have occurred thus far. For U.S. Senate, we have Jamie Harrison, and of course he is running against Lindsey Graham. I want to make everyone aware that tonight there is another debate between Jamie Harrison and Lindsey Graham at, I believe it's 9 p.m. And so please tune in to that debate or check your local listings to find out when that debate will be broadcast. If there's someone out there who's watching and they can get a hold of that information real quick for me, just post it in the comments and I'll make sure to mention it. But we've seen even that particular debate also. For U.S. Congress, South Carolina 7th District, we have Melissa Watson, who is running against Tom Rice, okay? And so just, again, make note of this so that when you go to the polls, if you're choosing to vote Democratic for Democratic candidates, you know who you are voting for. Okay, I've gotten word that the debate for tonight was canceled. Okay, thank you so much, Michelle. The Senate debate was canceled. Okay, for the Senate race, South Carolina Senate, there's several Senate districts and there's several House districts. So when it comes down to the Senate districts, you have District 34, which is Emily Sigledy. You have Senate District 30, Kent Williams. Senate District 32 is Ronnie Sabb. House District 55, Jackie Hayes. We have House District 56, Bruce Fisher. House District 57, Lucas Atkinson. House District 103, Carl Anderson, and House District 107, Tony Cahill. And then for Board of Education, District 9 is Edward Robinson. So if you have any questions or you want this information so that you can do your research before November 3rd, or before you cast your vote, should you choose to vote early, you can go to oridemocrats.org and pull up this information. You can also let the Horry County Democratic Party know whether or not you want to be involved in the actual election process. They have a high interest and a need for poll watchers, poll runners, and checkers. If you're interested in any of those volunteer positions, you can give them a call at 843-488-4237. And they'll be more than happy to talk to you about the rules or the instructions for working in any of these particular volunteer positions. And of course, if you need more overall information, you can always go to votebluesc.com about what's happening in the Democratic way. If you're riding the blue wave, go to votebluesc.com to find out more information. I also have a little bit of info about the absentee voting locations. So Horry County Voter Registration and Elections Office is a site for in-person absentee voting, or what people sometimes call early voting. You can vote there. It's located at 1515 4th Avenue in Conway. And of course, early or in-person absentee voting takes place between October 5th, which has already started, and November the 2nd. Okay, so you have until November 2nd to cast that early vote. We'll just call it an early vote since that's what everybody seems to identify it as. But you can go to the Horry County Voter Registration and Elections Office here in Conway at 1515 4th Avenue. Make sure you adhere to the COVID protocols by wearing a mask. The social distancing protocols should be in place. And I think that they're maybe handing out these long swabs so that you don't have to press the buttons with your fingers. But if you're concerned, take a pair of gloves, okay? There's really no excuse to shore up and be ready to go. An additional voter or absentee voting locations include the North Strand Recreation Center, which is located at 120 Highway 57 South, 120 Highway 57 South in Little River. You can cast your absentee vote there during the same time frame, October 5th through November the 2nd, and they are taking votes from 8:30 a.m. to 4:00 p.m. I'm going to back up to the Horry County Voter Registration Office. They're taking votes from 8 to 5, but the North Strand Recreation Center is taking voters from 8:30 a.m. to 4 p.m. The South Strand Recreation Center also has is a voting location. It's located at 9650 Scipio Lane, and that's in Myrtle Beach. And they are taking voters from 8:30 to 4 p.m. as well. And then we have the Carolina Forest Library, which is located at 2250 Carolina Forest Boulevard in Myrtle Beach. And they're taking voters from 8:30 a.m. to 4 p.m. I will post this information on my personal page and also on the network, and you can share it as much as you like. And I wish I had this graphic a little bit earlier, and I would have made it a part of this video in case you want to share it. But you can always share the video, and I'm actually, communicating that information aloud for all of you as well. So if you have any questions, again, about any voter activity or whatever, you can certainly be in touch with the voter registration office. If there's also a voter protection hotline number that I want to give you, it's 855-785-0222. That's the South Carolina Voter Protection Hotline. And you can use this hotline if you are experiencing any issues at the polls, whether it's the early voting locations or on November 3rd, whenever you go to the polls. Make sure that you let them know what is happening, what you're seeing. If there's anything that seems out of the ordinary or looks like it's acts of suppression or whatever the case is, you'll want to give them a call. One more thing that I think is highly important, and we can't stress it enough, and I think we need to stress it every show until it's the deadline has approached us. But you must please, by all means, complete the census. Complete the 2020 census. It only takes a couple of minutes to do the actual census survey. You can go to 2020census.gov, access the survey, and I think it may even take less than 5 minutes. If you know people who need to complete the survey, help them, especially our elderly who aren't as tech savvy. Help them to complete the survey. Of course, use your COVID protocols. If you're visiting someone, you can certainly do this and maintain the integrity of the census and also the protocols, especially if they're family members of yours. Make sure you try to help them out as much as possible. And if you have any questions or if you need any more information, visit this website to give you some idea of how you can handle that. But we definitely need to make sure that we are completing the census because there's so much at stake as far as political lines that are drawn, funding that's provided to us for resources across all communities. And when we give this information, please remember, everyone, this isn't just information for the Black community, although we have a specific interest in the Black community, obviously. But we're giving this information out to everyone because everyone is entitled and allowed to be a part of the democratic process. And we just want everyone to be informed on how to do that, to do it safely and to do it successfully. So, Dr. Mack, do you have any other thoughts or comments for today? And I'm going to just kind of scan the news real quick and see if there's anything I may have missed from the network that I want to let people know about.
Yeah, in regards to the census is very important because the funding for healthcare, not only with who we elect politically, but also the census actually plays a major role in things such as Medicaid, Medicare Part B, children's health insurance, prevention and treatment, and substance abuse and other issues. A lot of the funding is tied to that. Also, places that are considered medical deserts where they're not clinics or hospitals in certain counties in South Carolina and other states are actually dependent upon census information. So it's very important to help your county out, help your area out by filling out the census forms so that way you can be counted and the needs that are there will be taken into consideration. In other words, if you're not filling out the census and they don't know how many elderly people are there, certain funding that goes along with elderly that money won't get there. Same thing with children. So it's important to make sure that the census is completed, filled out, and taken very seriously. It's only done every 10 years. So if you don't get it right now, you got to wait another 10 years before some of that funding that should be going to your area will get there.
Absolutely. And I just wanted to make mention that someone whose name I'm not going to call today, but someone posted a compliment on the podcast that I completed. You know who you are, and everybody can see her in the thread. But someone, the icon, posted a comment about a podcast that I did with Dietrich and Joy Bonds. It's called Sojourn. And I had a lot of fun with them, and we actually talked about, some political things, the election. It was actually the same night that Kamala Harris debated Mike Pence and the Fly, and so and so if you will take a moment, I'm going to post that link in the chat. If you'll take a moment to just listen to that really quick broadcast, we really enjoyed that. And the bus, it's on buzzsprout.com, but we just kind of talked about some thoughts and insights from our perspectives on, the upcoming election and, what's at stake in our community. So just take a few minutes to listen to that. And also, subscribe to their podcast. I think it's a wonderful thing. But Dr. Mack, as always, I just want to thank you. I also want to thank the Emmanuel Nye Memorial Foundation for being a live stream destination for this broadcast. We certainly do appreciate having any viewers or watchers from that particular destination join us every single week. And so next week, if God says so, we will be back with more COVID-19 updates. And we may have a special guest. I don't know, but we'll put the flyer out as soon as we can confirm some things. Dr. Mack, you remain safe, and thank you for all that you do in our community. We really do appreciate it.
Thank you. Thank you.
All right. Okay. So everyone, take care. Have a wonderful weekend, and we'll see you next week if the creek don't rise and God says. Right. All right. Have a good one.
All right.